People with dementia may have symptoms of hallucination, delusion, or paranoia due to brain damage. This video will teach you practical tips to care for them. Be sure to watch until the end because the best strategies might not be the ones that first come to your mind. A hallucination is a misleading sensory perception of objects or events. The patient may see, hear, smell, taste, or feel something that isn't there, for example, insects crawling on their hands or voices speaking to them. A delusion is a false concept or belief that might arise from a misinterpretation of a circumstance. For example, a person may believe a movie star is in love with them. Paranoia is similar to delusion in many ways, but it describes the type of suspicious illusion. For example, the person with paranoia believes that others are trying to harm, spy, or steal from them. To a dementia patient, hallucination and delusion may or may not be distressing. They can be the mechanisms that a person makes sense of situations. For example, if the person cannot recall putting her keys away, she may believe they were stolen. The following are things that the patient and caregivers can do to deal with these issues. The first thing is to rule out other causes. Seeing the person's doctor is the first step. Many physical factors, such as infections, dehydration, discomfort, drug misuse, vision or hearing problems, can create hallucinations or delusions. A doctor's visit, vision or hearing tests can help identify the root causes. Medications can also be the source of the problem. If you are taking a prescription drug, watch out for and report any side effects to your doctor, such as drowsiness, confusion, tremors, etc. Tips for caring for Alzheimer's patients with hallucination, delusion, and paranoia. There are non-medical and medical interventions to relieve the suffering of someone with hallucinations and delusions. These approaches are: 1. Evaluate the behavior and consequences. The first question to ask: is the hallucination or delusion harmful to the individual or others? If the answer is no, then the best approach is to ignore it. For example, a girl believes Brad Pitt is in love with her, and she watches every movie of the star and hangs his posters all over her bedroom walls. It might be annoying to her family, but it does not warrant active intervention. It is also important to note that debating their hallucinations or delusions is not a good idea. Not only does it not correct their misconceptions, but it may also lead to agitation and harm the relationship between you and them. 2. Reassure the individual. With nice words and a gentle touch, reassure the person. For instance, you could say, "Don't worry. I am here to look after you." Or, "I understand you're anxious." Or, "Would you like me to walk with you for a while and hold your hand?" Gently touching the person on the back may draw their attention to you and help to alleviate the condition. Also, try to figure out what the hallucination or delusion means to the individual by looking for causes or sentiments behind it. For example, you could say, "It seems like you're concerned." Or, "I know this is frightening for you. Can you tell me about it?" What if a loved one is upset or needs your assistance? Find out what's bothering them and see if there's anything you can do to assist them. 3. Redivert the attention. Suggestions include taking a walk with you or sitting next to you in another room. Frightening hallucinations and delusions generally go away in sunny locations with other people around. You might also try diverting the person's attention to a favorite hobby, such as drawing, browsing through a photo album, or counting coins. Do some activities both the person and you can enjoy. Play their favorite tune or do a puzzle together. Sometimes, the person is too fixated on their hallucination or delusion, and you cannot shift their focus. It is normal, and don't stress yourself. 4. Tell the truth. Sometimes, the person tells you about their hallucination or delusion and asks you about it. For example, when the neighbor's cat passed by, he said, "See, this cat is on to me. Why does he do this?" You might respond, I know you are suspicious about the cat, but he always climbs the oak tree, then go back to the neighbor's house like this. This way, you tell the truth while not refuting the person's delusion. However, it is not a good idea to create another layer of reality by saying, your neighbor asks the cat to say hello to you. It could make a complex relationship between the person's delusion and the neighbor. 5. Be empathy. Instead of arguing or proving them wrong, the better approach is to see the reality from the person who has hallucination or delusion. Being understanding is the first step to establishing a caring relationship. Furthermore, the hallucination or delusion might be a reflection of unmet needs. A senior lady tells you, my son is crying. He must be hungry. I need to go. You may consider these scenarios. Is she feeling lonely? Is she missing her son in another city? Is she feeling hungry herself? You can take action to meet her needs and at the same time divert her attention. For example, do you want to call your son and talk to him, or shall we go to the market to buy some food? 6. Remove possible triggers. Changing the environment, removing, or replacing items can sometimes remove the triggers. The following are some practical measures. Cover the carpet or remove the blinds if particular patterns trigger hallucination. Increase or change the lighting to eliminate shadows. Keep mirrors to a minimum to avoid confusion. For example, only have a mirror in the washroom. Replicate or replace easily lost items, so the person has less chance thinking about lost something. 7. Medications. As a last resort, medications are available and all the above measures fail, and the symptoms affect the individual's life. Seek a consultation from a doctor to thoroughly explore the person's mental health history and medication usage. A doctor can help to develop an effective treatment plan. This video is completed. Thanks for watching. A quick reminder, this video is for information only. Please seek medical advice from appropriate healthcare professionals. If you like the video, give it a thumbs up and share it with your friends. Please comment below to share your thoughts about delusion and paranoia.